And let's dive into that. What made you say, I'm going to be a dentist? Where did that journey begin?
All medicine has gone very corporate. And I just want to hold on to that mom and pop feeling in a practice.
Hey, you should get your wisdom teeth out. I go, do I need to? No, but one day down the road, they may give you problems. I'm like, but are they going? No. So am I good?
You're...
And I might just bring us in here. Hello, everyone. Welcome back to Talkin St. I'm your host, Ryan Bogden. Before we jump into today's guest, we are drinking wine. I just poured a little wine because we're getting loose and goose because it's Good Friday. So I don't know when you're listening to this, but this podcast is sponsored by Bogden Homes. If you know anyone looking to buy, sell, or invest in real estate, find our contact information in the description below. And now into today's lovely guest, the most kind human being on the earth, Dr. Alexa Moccia with Sunshine City Dentistry is on the podcast today, folks. And I'm so excited to have you because you were one of the first guests that I thought about having when I had the idea to start this podcast.
Really?
I bet you didn't know that.
I had no idea.
So no pressure.
A lot of pressure.
No pressure. No pressure. You not only are an amazing dentist, which we need to jump into and figure out how you got there, but your fitness regimen is out of this world. We were just talking about that, and it's the big reason I know you. Thank you to Jody and Sweat for creating the community.
Shout out Sweat.
Yeah, shout out Sweat, right? So why don't you tell everyone, let's dive into that. What makes you, how did you say, I'm going to be a dentist? Where did that journey begin?
That's my least favorite question.
Really?
It is because
let's get it out of the way then.
Well, I've never known the answer.
Well, did family?
I've had no family in any sort of medicine, dental.
Okay, so you're going to school, and at some point you decide.
I was like this big.
When you decided? Mm-hmm. Oh, so this is like from day one.
Yeah. I was like one of those weird kids who like
obsessed with teeth and wanted to be in people's mouths.
I didn't want to be like, I don't want to be an astronaut. I don't want to be a singer or whatever. I was like, I don't be a dentist.
And for some reason, why do I think of the, is it from the movie Rudolph? Right? Isn't it one of the elves want to be a dentist?
Yes.
Like that's what he wants to. He doesn't want to make toys. He just wants to be a dentist. Is that you?
That was me. Yeah. So I always did, and then I feel like I kind of like got refined.
Let's just keep this a little closer. That's all right.
Got refined as I got older, and I loved my dentist. He was also my soccer coach, so I knew him like in a professional way, and then through sports, which I loved growing up.
Yeah.
And I went to shadow him a couple of times, and I saw how happy he was, which I feel like you don't meet a ton of people that are just really happy at their job.
Yeah.
And he loved it. And I was like, I could definitely do this.
I want to dig in people's mouths.
All day.
All day. Well, you do a great job, and thank you. You've taken me in.
Of course.
As a patient. You. Yeah, so just a little backstory there for people that don't know. I have been doing Invisalign treatment for way too long.
Forever.
We will not say how long. I started in Philadelphia and moved here and called a couple offices, and they wouldn't take me in. They didn't want to because I was starting in the middle. Mm-hmm. And you were so kind to say, come on in.
Of course.
I'll do it. Yeah, so really apprate that.
Of course.
You and your staff.
I was happy.
You're happy to take me in?
Yeah. Yeah. Well, I knew you had Sweat. I was like, why wouldn't I?
Right. Yeah, well, we still got to get there. We got to get it wrapped up and finished, in terms of my treatment.
Yeah, I know.
Yeah.
Chris has been calling you.
Yeah, yes, I owe a call back for that. So, but this started, where are you originally from?
Massachusetts.
Massachusetts.
Yeah.
Okay. And how long have you been in St. Pete?
Almost 7 years now.
Yeah? Mm-hmm. Okay, so you're in Massachusetts. That's where you did all your school, right? I think I got notes here. I did my homework. You did your doctorate at Boston University, yes?
I did, yes. Yeah. I did my undergrad and my dental school at BU.
Yeah, so you just rolled right.
I loved BU. I would go back again if I could.
Yeah? Mm-hmm. You like the cold?
No.
You're like, no.
No, I hated the cold, but I loved the school.
Yeah?
And Boston's a really cool city.
I've never been.
You've never been?
No.
Ryan.
What's so cool about it?
Everything.
Sell it. I mean, we're on Talkin St. Pete, but tell me about Boston.
All right. Well, I mean, I love St. Pete. This is where I chose.
Right.
But Boston it has so much history, so much culture. There's a million things to do. I don't know the number. I knew it at one point, but I think there's over 100 schools. So going to college there were students everywhere. So there's a ton of innovation. People were always trying to create things and grow things and do new things.
Yeah.
And then it's like St. Pete, a lot of mom and pop shops. There wasn't a lot of chains.
Oh, okay.
So things that were just just in Boston.
Yes. So the community was strong.
Yeah.
Strong community, lots of students.
Tons.
I don't know how I'd never been. I mean, I was kind of close when I lived up there. I'm from Pennsylvania. Just never.
Yeah, you were right there.
Never.
Skipping a jump.
Yeah. It never jumped out as me. And now when I think about it, I just think of the cold.
Go in the summer.
Yeah, I would have to if I'm
Yeah.
going to visit. You're not the first person that's told me I need to go there either.
Oh, it's an awesome city. But in the winter, you get like, you have sunshine, I think, from like 8 a.m. to like 4 p.m. And then it's dark and freezing the rest of the night.
Yeah, no thanks.
So, yeah.
Yeah, no thanks. So how'd you end up here in St. Pete?
So after dental school, I was going to do a 1-year residency, a general practice residency. And I was looking at either staying up there or coming here. And at the time, Steve, my fiance, he was in New York or New Jersey. And he didn't want to come to Boston. And I did not want to go to New York. So we came down and toured in St. Pete for the residency, and we fell in love with it.
And how long ago was that?
It was November of 2015 that we toured, moved in May of 16 when I graduated.
Got it. So you were here a little before the boom.
Before the boom.
Before the boom.
Yes.
Yes. Oh, so you're OGs then to St. Pete.
But when we came down, because it was before I didn't know anybody in St. Pete, and I don't know anybody that came here. So we went downtown to like check out the scene, because the residency was in Seminole. So all the interviews, and we were staying over there. And we went downtown, and I thought Central was like from the water to, you know where like Ruby's Elixir is?
Yeah.
What is that like?
Yeah, like second.
Yeah.
Yeah.
I thought that was it.
That was it.
And
Central didn't keep going. I mean, Central goes all the way.
Now it does. It almost connects to the beach already.
Right. It's going to at some point.
I can't wait. I love it.
It's so funny because I just had another podcast on here. So if you see me wearing the same shirt, folks, that's why. Like I do 2 of these in one day. And she'd been here since she was a teenager.
Wow.
So I don't know how many years, but Central was never a place that you would go. It was
That's what I've heard.
Yeah, it was boarded up. Prostitutes, drug dealers, all the things.
Love it.
Now look at it.
I know. It's so different.
Yeah. What do you like? I know you like to go out. You're a little bit of a foodie, no?
I am. I love going out whenever I can.
Yeah. Where do you like to go?
In St. Pete?
Yeah.
Well, actually,
St. Pete.
I say in St. Pete, but like I go anywhere else. Honestly, one of my favorite spots. Have you ever heard of Copa?
Copa. I think I've driven past it.
It's on Central, right by Intermezzo.
Oh, yeah. But I haven't been.
Intermezzo. So it's like Caribbean flair for the food and drinks. Then they have hookahs. They have indoor, outdoor. They have live music.
I think I've seen you sitting there once.
Just once.
Right. I haven't been, but I have. Yes, I know exactly what you're talking about now. It just has been one of those things. Like there's so many cool spots. It's hard to keep up. And now Intermezzo's moving.
Right next door.
Yeah.
To Copa. This
Crazy.
is perfect. I could just go from one to the other.
This is your dreams come true.
Yes.
Okay, so you did residency here. That was 2016, and so how do you end up with your own practice?
So I always wanted my own practice, which it's when I finished residency, I went into a private practice in Seminole. It was called Seminole Dental, and it was an awesome practice, amazing team. And I got that job because the doctor that was doing the endo program at the residency, Dr. Rillman, he kind of hooked me up because the dentist that was there bought her practice in Tampa, so she was leaving. So I transitioned in there. I was there for 5 years, and for a long time I was trying to buy Seminole Dental. And it wasn't for sale, but I was kind of holding out and hoping for a long time just because I love people. So like I get so connected with the patients, and it was really hard to like leave them. And the girls that worked at the office, again, like they were amazing. It was hard to leave everybody, but it wasn't an opportunity that I was ever going to have. So then I was reaching out in the community, and it was a temporary hygienist that came through Seminole and knew Dr. Bloom, who was selling his practice. So she kind of like got us
little connection
talking. Yeah.
Yeah.
But I always wanted to own. A lot of dentistry has gone, like all medicine has gone very corporate. And I just want to like hold on to that mom and pop feeling in a practice where like, people, you get to spend time with people, and it's more of a family than it is, like a doctor's office.
Yeah.
Or something.
No, your place is cozy.
Thank you.
Yeah. You brought in the plants. You're doing all the fun things.
Trying
New
to.
decorations. Yeah.
Yeah, I don't want to feel like a dental office.
No. A lot of people don't like going to dentists, but I kind of enjoy it.
Thank you.
Yeah.
You should. You can hang out with me.
Yeah. Get to hang out a little bit. I don't mind coming in there. It's even though I get razzed and all the fun things, but that's me because I'm a bad patient. But okay, so that's cool. So you just had a connection through another hygienist and then connect you with Dr. Bloom. Mm-hmm. So anyone who knows, what street is that at that you're all?
It's on First Ave North at the cross street of 58th.
Yeah, 58th and First Ave North. Dr. Bloom's office, and now it's Sunshine City Dentistry. You got to say it with some extreme emphasis.
Yes. Yeah, no, you got to say it slowly because you can say it wrong really easily.
Yeah. Let's say that 4 times fast and tell me what you end up with. Okay, but that's not the only thing you do.
No.
Yes, so you're spending a lot of time at Cycle Bar.
Yes.
On the wrong side of the bridge, I might add.
I'm sorry.
So how did you get into that, and how long have you been a cycle instructor?
So I've been a cycle instructor since I was 19. Oh, no, I'm saying my age on camera.
19?
Yeah.
Okay, but no one knows how old you are now. But really, you've been going for a little bit.
15 years almost.
Yeah. Mm-hmm. That's pretty cool. Mm-hmm. I'm definitely afraid to take one of your classes.
Why? Ryan, you'll kill it.
Yeah. My legs are like chicken legs.
No. You will be totally fine. You don't have to. You jumped over the box. Remember that?
Right.
Your legs are just fine.
Yes. Okay, but so you were in cycling classes then before they're like this hot trendy thing now.
Yeah. So I started when I was 14 riding. My first job, I was a lifeguard at my parents were members of a club. And so I was lifeguarding at the pool, but I was 14, so I couldn't drive yet. So I got a free membership to the athletic club, and while I'd wait for them, because both my parents work, so I waited after my shift for them to come pick me up, and I started spinning.
Okay, so let's talk about spin for a second, because it's a hot, trendy thing, and it has been for the last few years. How has it changed since you started? Because now we got the music and we're dancing and we're doing the things. Has it always been like that?
No.
Okay, so how was it when you started versus how it is now?
So when I started riding, it was a bike is a bike, but You know how you clip into the pedal now?
Yeah.
It was a cage, and you slid your sneaker in, and you locked it in like the rowers.
Right. Yeah.
And you just try to strap it down. Yeah. You didn't ride to the beat of the music, so the playlist could be anything.
Okay.
And the instructor was just at the front of the room, no mic, no nothing, just like yelling at you. So you still have the positions, like you have saddle, 2 standing, out, and 3 when your hands are extended. But that was it. Like you didn't really do you didn't do any choreo, and then you just do basically intervals.
Okay, so wait, no choreo, meaning choreographed. That's because you guys are now having everyone half dancing while they're riding these bikes. Am I wrong?
No, you're right. You're right. Some of it's a little over the top. I give you that.
Yeah, like the music is blaring. We got lights are flashing.
Yeah.
Things are going crazy.
Full experience.
Yeah. So when did you see that? When did that become the trend?
That was when I was in college.
Yeah. So
when I first started teaching, it was a different certification. It was Mad Dog, and that was basically like your interval training. And I remember my first spin job. I carried a boombox into the room.
Oh, no.
I burned CDs.
Yes.
Do you remember that?
Yes, of
burned
course.
the CDs, popped it in. Again, no mic, so I'm just sitting up there screaming at everybody. And then when I was in college, I saw some of the like little boutique spin studios start to open in Boston, and that's when I left from like a gym setting and went to what is now Handlebar in Boston, and they did like the choreo, riding on the beat, the whole 9. And most of those studios do their own in-house training.
It's pretty cool. I mean, I've done one. One class.
It wasn't mine.
It wasn't yours. It was when I first moved here. I don't think I was going to Sweat. I wasn't going to Sweat yet.
Really?
It was at Lifetime Studio and the gym in Tampa. They had like a little Lifetime gym. It's in the International Mall. Yeah.
You went to
the gym? Look, it's still there. It's a nice facility. Okay.
Okay, I'm sorry I'm laughing. I didn't expect that.
No, I know. Well, when we first moved here, because when I moved here, I only knew my sister and brother-in-law. And my brother-in-law was going to Lifetime because they had the sauna and the steam room and the jacuzzi and all that jazz. And they had yoga there. So it was like an all-in-one, and they had the cycle studio. And he was like, yeah, bro, you need to come do one of these cycle classes with me. And all I can remember is that the speaker was right behind my head, and it was so freaking loud. Mm-hmm. It was too loud. It was almost giving me anxiety. Like I felt like I was at a rock concert, like heavy.
Well, because it depends where you sit in the room.
Yeah.
Some seats you don't really hear much.
Look, I come to your class. You can't put me near a speaker.
Fine. I will get you the best bike.
Where is it? Where's the best bike in the room?
My favorite bike is bike 12,
okay,
which is in the middle of the first row.
Yes.
But the speakers are towards the side, so you kind of get you get from both sides
it's even.
Without it blaring. You would probably prefer like bike 24, which is second row.
So I'm not in the front.
So you're like hidden a little bit.
Yeah. I don't want to be quite out there embarrassing myself as I'm dying.
That's fine. I will embarrass you. I'm just kidding. I would never.
Okay, so you've been doing that for a while. Mm-hmm. And so, when do you find time to do that? When?
Well, right now I only teach Wednesday mornings.
Okay, got it.
Wednesday, 6 a.m., Hip Hop Hump Day.
Hip Hop Hump Day?
Say that 3 times fast.
Hip Hop Hump Day. Yes. Okay, that sounds fun. I told you before we started, I owe you an apology because I really did mean to come to a class so we could talk about the experience. But now, since we're live here on camera, I commit to coming to one of your classes.
Yeah, you heard it.
Yes, you're a good friend.
Sign him up.
Yeah, sign me up. Let's make it. We'll have to check the calendar. Maybe next Wednesday.
Okay, you tell me.
Yes, I'll be there.
I'm there every week.
I'm so nervous.
Why?
I don't know.
There's no way you're more nervous for that than I was for this.
Yo, are you going to bring me wine to the cycle bar studio?
Well, it's 6 a.m. I'll bring you a mimosa.
Yeah. Fair enough. So if we're going to go back to dentistry just for a minute, because I want to keep talking about your business.
Sure. Thank you.
What is some common things people are doing wrong with their mouths?
Okay.
Yeah. You're like, what? There sounds like there's a lot.
Let me get a list.
Yeah.
There's no replacement for dental floss.
Is that number one?
That is number one.
We got to be flossing, folks.
Yeah, please. Not the picks, not the stick things. Traditional floss. If you don't know how to do it, find me. I will show you how to use it. It's easier than anything else once you're doing it right.
Yeah, okay.
Please don't use anything with charcoal in it.
No charcoal.
No charcoal.
Okay, so 1, floss your damn teeth, and 2, don't use the charcoal because that's like a trendy thing on social media.
So trendy, and now they have floss with charcoal.
Oh,
yeah.
I'm not. I buy the cheapest floss, 98 cents, whatever it is. Yeah.
It's probably the best. Same thing with toothpaste. Like there's these super fancy, they have all of the glitz and glamour and whitening and blah, blah, blah. Top shelf, $10 for a bottle. You go right to the bottom, get that Arm & Hammer.
Okay, so what's wrong with the charcoal?
It's abrasive.
Got it. So
a lot of the whitening that they market, it's like abrasive particles in the toothpaste that wear away. It wears away any plaque or anything you might have on your teeth, but it also wears away the enamel.
Oh, that's not good.
Mm-mm.
Yeah.
Because once you lose your enamel, it never comes back.
Really?
It won't regenerate.
Okay, that's not good. So stay away from charcoal. So floss and charcoal. What else are we doing wrong? Is that the two main things?
Those are the two main things. I mean, electric toothbrushes are amazing.
Yes.
Yeah. Also,
do you have a preference?
Oral-B.
Okay.
They have a new one. It's the IO toothbrush. It vibrates less because one of the things that I found myself personally, I hated using the electric toothbrushes because they rattle your whole head around. But whatever they did when they changed the Oral-B changed to this IO, it rotates and it oscillates, so it breaks up the plaques really, really well, without vibrating in your head and driving you nuts.
So when I first started using an electric toothbrush, I must have been using too much pressure and I wore away my gums.
Now they also have pressure indicators.
Oh.
So if you press too hard, with the Oral-B, if you press too hard, it goes to the bottom will turn red. So you know you're pressing too hard.
Got it.
If it's with the Sonicare, it'll vibrate a couple of times. So again, you know you're pressing too hard. It lets you know.
Got it. Okay, that's good. Maybe I need an upgrade.
I have.
Hello.
Yeah,
hello.
Come anytime.
Yeah. Okay, that's good. That's good because that is one thing. You can't brush too hard. Wear away the gums. Do they grow back? Do gums grow back?
No, but they can be grafted.
Graft in. What does that entail?
Grafting?
Yeah. I have heard of it, but I don't really know what that means, and it's kind of scary.
I don't do this, so it's not scary. But for a traditional gingival graft, they'll take gum tissue from your palate and transplant it to get more attached tissue. It doesn't always give you more root coverage, but what they want is attached tissue to support the tooth. Again, I don't do this. I'll send you to somebody else.
Okay, great. There's one thing I will say. If you go see Dr. Moccia and you're sitting in her chair, she'll talk to you in big, fancy dental terms. And I have to say, talk to me like a fifth grader because I have no idea what you're saying.
I'm trying really hard.
And I joke and I make this funny, but our tooth care is important.
It is.
Everyone needs to go see you.
Thank you.
Yes, of course. And a lot of people hate the dentist. Why do you think that? Why is that? They just can't stand. I don't know. I just sit there and meditate.
Our generation, I don't know. I don't understand because I've always had a good experience.
Yeah.
And like we are like our generation is kind of spoiled. Like we're always getting numb. Like there are massagers in the dental chairs, and there's TVs.
You don't have that.
I have a massager. You've never used it?
Oh, you got to turn that on next time. I'm getting gypped.
All right. I'll tell Melissa.
Yeah, what the heck?
We got to put it in your notes.
Yeah.
But older generations, I mean, they had horrible experiences because a lot of time, at one point, you had to pay for anesthetic. So it wasn't included. And then, just the technology has come so far. Like the handpieces now can cut so efficiently without a lot of chatter, without a lot of time. So the experience is much different on the patient end instead of having.
How often should we be getting our teeth cleaned?
For a very healthy mouth, every 6 months is fine. Anybody else is every 3 months.
I'm on the 3-month rotation.
I mean, to be honest, if I could be on a 3-month rotation, I would love that.
Why can't you?
I mean, I just don't have time.
Fair enough. Okay, so you got the comfy chairs, which I'm just finding out about.
I'm sorry.
Yeah,
holding out on you.
It's okay. And things are new and improved, and we don't need to fear the dentist as much as we used to.
Especially if you floss.
Yeah. True. Okay, so you've taken over this practice. When did you buy it?
It'll be. Well, I was just a year in January, so almost a year and a half.
Well, congratulations.
Thank you.
Yeah, that's really exciting.
Thank you.
And so now, are you absorbed in the patients that were there? That's a good deal.
Yeah.
And now you're bringing in awesome friends like myself, right? In through the practice.
Trying to.
And do people change dental offices often? Like
Again, it's our generation.
Yeah.
So most of the time, people find a provider, and because a lot of times, like people that come through for recare and don't really have a lot of dental work, they see the hygienist a lot more than they see me. So they develop a relationship with the hygiene team.
Well, yeah.
And typically, you don't want to switch any medical provider too often, just because to know somebody, where they've come from, what they've already experienced, the work that they've had done, how the work went. There's a lot to be said for that continuity of care with the patient. But now people shop around for everything.
It's wild.
Yeah.
Yeah.
And they'll go because a lot of offices will have like specials or deals, and you can get like your initial exam and cleaning for, I've seen as low as like $69. So they'll go, and then 6 months go to another office, and 6 months go to another office. But there's nobody really watching over the changes in your mouth because you just keep popping around.
Right. You have no idea what's happening.
Yeah.
Yeah. And I mean, my experience when you go to a new office, I've only done it 3 times. You're my third dentist ever in my life. Yes. Gotta get new X-rays. And those are costly. I mean, unless you have coverage and all that. But okay, so that's it's dentistry. It can't be super exciting. I'm trying to make it super exciting.
I get it.
Yeah,
I mean,
right.
Same. I try to make it.
But at the same
as
time, you only get after you lose your baby teeth, you got one set.
Yeah, you got 28 to 32 that come in, and that's all you got.
Is that if we have our wisdom?
Yeah, you have 32.
I do. Fun story, because I think this is just a good fun time. When I was in the military, they constantly told me every time, hey, you should get your wisdom teeth out. I go, do I need to? No, but one day down the road, they may give you problems. I'm like, but are they going? No, they look good. Well, you're not practicing just for shits and giggles on taking out my wisdom teeth. Like, that is just not something. And so am I good?
You're good.
Do I need to take them out?
No, I wouldn't. I would support you taking them out, but you don't need to.
Okay, so let's talk about wisdom teeth, because what a fun topic, right?
Please.
Why? What's the issue? And so a lot of people, is it they don't have room?
Most people don't have room. Most of the
I have a
time
small
they're
mouth. I don't understand how mine are okay.
Well, they're
You're looking right now. Like,
it's not that small. Your teeth are erupted. They're functional. Most people have impacted wisdom teeth. So they're either bony impaction is going to be underneath the bone, or it's a soft tissue impaction. So there's soft tissue that's still covering a lot of the tooth. You can't clean it. So a bony impaction over time the bone can change around it. It can cause problems down the line because your body's always changing. Soft tissue impaction, it can start to communicate with the oral environment.
Yeah.
And then if it's communicating, bacteria, plaque, food debris, everything can get in there and again, cause problems.
She knows her stuff, folks. That's all I get from that.
Did that make sense?
No, it does.
Okay.
I think so. I think it makes sense. Yeah. Yeah, no, it does. I just want everyone to know that you know your shit and they need to go see you because a lot of people listen to this aren't from St. Pete or they're coming here, right? And so you got your dentist, folks. That's one thing you got to figure out, you know? Yes. It's one of those things. So go see Sunshine City Dentistry. Back to St. Pete.
Yes.
You've been here for a little bit. So we got the foodie thing. You like to go to Copa.
Love Copa.
Love Copa. Where else do we like to go?
Trophy Fish.
Trophy Fish.
Oh, probably my favorite spot.
Yeah, that's where we celebrated your birthday.
2 years in a row now.
Okay, good spot. What is it about Trophy Fish that you like?
The food's excellent. It's always so fresh. And then I just love the experience. I don't really like the big foo-foo. Like I don't want to have to get dressed up and everything. I like to just go and hang out.
Yeah.
They have a great bar. They usually have live music. And obviously, I've said it twice, I love live music. Mm-hmm. And the food is always fresh. So you can just sit there, bring anybody you want to.
It's a cool vibe.
Yeah.
Outside.
It's easy. It's fun.
Yeah.
And I also love being outdoors. If I could be outdoors all the time, I'd have a convertible dental practice, open the roof up.
That'd be cool.
That'd be so cool.
We're already laying on our back. It'd be cool to look at the clouds go by.
I don't know how to make it sterile.
Yeah, fair enough. Fair enough. Okay, so Trophy Fish is cool. We got to find the owner. Do we know the owner of Trophy Fish? I do not.
I don't.
I don't know. Someone leave in the comments below. Find them. I want to get them on here. What else do you like to do in St. Pete besides go eat and drink?
Well, you will often see me running in Vinoy with my dog Bear. That's one of my favorite things. I've always loved running, so I'll always go along the water, down Coffee Pot, and then sometimes I'll take the paddle boards out. I've done Coffee Pot a couple of times. I love going over to the mangroves around Getaway and Weeden Island Preserve.
It's nice over there. You know, one thing that's special about St. Pete that was just brought to my attention, because I always ask, okay, what is it about St. Pete that's so awesome?
Everything.
There is everything. And Wendy Wesley, who was just on prior to you, said it's because there's 30 miles of direct waterfront where there's no buildings.
Wow.
Think about that. You can go from Vinoy, you can go down to Gulfport, you have the beaches, you have all this access to direct water where there's not buildings right up to the water.
I never thought about that.
Me neither.
Wow.
Until an hour ago.
Right now.
Yeah. And it was one of those things of that is so special because where else do you get to go run right along the water consistently and most likely see dolphins?
Almost every day. And manatees. It's so cool.
I haven't seen a few manatee, not as often as the dolphins.
Well,
you see them often down there?
Coffee Pot, there's it's right past the Snell Isle Bridge. There's a little nook, and I don't know if there's an outlet of some sort, but there's always manatee hanging out right there.
That's cool.
It's really cool.
It's good to know. Coffee Pot Boulevard, folks. Go look for the manatees. Yeah, right by the bridge going over to Snell. You got to look for Snow Isle. There's a bridge, if you don't know. The locals know. But not everyone listening to this is locals. Yeah, just that thought about the waterfront is really, really cool. And she told me that was a thing that they put in place 100 years ago.
Really?
How fascinating is that?
Intentionally?
Yeah.
Wow.
Super intentional. I know that the Vinoy has something in place to Vinoy Park. Nothing can ever be built there.
Good.
No, that would ruin
it. Yeah.
And I ask people all the time why St. Pete? What makes it so special? And we talk about the community and the food and blah, 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 all these things, but no one has said about the water, and that is a very, very special, unique thing that we have here.
That's a huge part of it.
Yeah.
Because it's so peaceful to be by the water.
It really is.
You have a long day and take a quick jog, and even if you just sit on the wall and look out at see a couple of dolphins.
Yeah. Or start your day there. That's one thing I really like. And we've seen each other a couple of times because when there's it's other than a quick, hey, you're doing your thing, I'm doing mine. I'm sitting on a park bench watching the sunrise, just meditating, hanging out. It's a great way to start the day. But to that point, St. Pete, like you see people everywhere.
Everywhere, which I love.
I think it's cool.
I think it's so cool.
Yeah, and that's part of like the gym community that we're a part of, and all the other communities that are a part of St. Pete. There's so much love, but what do you think we're missing?
Okay, I was thinking about this, and I really have no idea. What are we missing?
I don't know.
I asked Kaylee this morning. I was sitting in the car, and I was talking to her.
Were you looking over the questions?
Yeah, I sure was. And I looked at her. I was like, I really have no idea. And she looked at me and she laughed, and she goes, "Affordable housing."
No, that's a huge thing. It's a huge thing. We something that's been talked about a few times, and that we have to be conscious of the rising in prices here, because we have healthcare workers or those running the restaurant industry, whatever, that need to be able to afford to live here to keep it special. And so we really have to watch that.
Well, and that's part of it, that St. Pete has every walk of life.
Yeah. No, it's true. And so accepting.
Yeah.
Of everyone.
Yeah.
Whether you're an artist who spray paints buildings to mega developer of some sort, right? We have all walks of life. Yeah, so you like and enjoy reading on the beach. I read that somewhere in one of your bios.
I do.
Yeah, so what books would you recommend?
Well, I only read fiction, which is probably to my demise. I know I'm not.
No, but hey, you gotta take a break somewhere.
Yeah, that is my break. I love like diving into a story.
Yeah, someone listening right now wants a new good fiction book. So what are you reading?
So recently, I read The Guest List.
Okay.
Which was phenomenal. Like edge of your seat, kept you guessing. I never guessed the ending while I was reading it, and I love those stories that like take that plot twist, and you're like, I did not see that coming. But my all-time favorite. Two all-time favorites. One is Mystic River, and part of the reason I love that is because it took place in Boston. So I like knew a lot of the landmarks. And then I love Tuesdays with Morrie.
I feel like I've heard of that.
I'm sure you've heard of it.
Yeah, I definitely didn't read it.
It's like this big. It's a tiny little book, but it's kind of like teaches you important lessons on life, like things you already know about.
Yeah. Yeah, that's funny.
But it's also a good reminder, especially because like it's easy to lose yourself.
Right. So you're reading on the beach?
Yep.
What beach do you like to go to?
Pass a Girl.
Oh.
It's so pretty.
Yeah, a little quiet down there.
Used to be.
Used to be. You're right. Right. What's well, I don't want to say. Maybe you don't want to say. When's the best time of day to go down Pass a Girl?
I have no idea.
Yeah, it's
every
always
time I go, it's busy now.
Yeah. Pass a Girl's a cool place. Place. It's the Beverly Hills though of the beaches.
It is.
In terms of price point, no, it is. It's
Oh, really?
Yeah. No, it's
like real estate wise.
Yes, real estate wise. There was a house down there over, and it may still be on the market. We'll have to look to see see if we can pull it up. And if it is, we got to find it, team. We got to make sure we insert this picture of this home. I think it's just so funny. It's over $1 million home. It's like 700 some square feet. The toilet is in the shower. That's Pass a Girl. You're paying over $1 million bucks for less than 1,000 square feet, and you can wash your feet while you're sitting on the toilet.
But you can walk to the beach.
Yeah, you can walk to the beach. Wash off your sandy feet.
Yep.
Yeah.
I would do it probably. Whatever.
That's Pass a Girl, folks. That's Pass a Girl. A cool place, though. I really do. I need to spend more time out there.
You don't go to Pass a Girl?
Not often.
Where do you go to the beach?
Upham, PCI. Like if I go to the beach, I'm having a good time.
I like recently discovered Upham.
Yeah?
Yeah.
Where have you been? You've been here since 2016.
I know. Well, I went to go to I'm a creature of habit. I go to the same places, but I went for my girlfriend had a bachelorette like yoga thing on Upham Beach.
Just cool things that happen here.
This is why we love St. Pete.
Right.
And I was like, this is beautiful. And it's another place. Have you been to Grove Coffee?
No.
You need to try Grove Coffee.
Writing it down.
It's so good. You can walk from Grove to the beach.
Okay.
And then back. I don't think you could say parking there, but grab a great coffee.
But Upham's cool because you got parking there. If you get there early enough. You got to get there early.
Yeah.
Like, listen, folks, the trick is you got to go to the beach early or you're circling forever.
Late.
Or yeah.
You could go if you wait, because a lot of days I'll wait till like 4:30, 5 o'clock, and you get the people that are leaving the beach that have been there for a long time.
Right.
But you can't midday.
No.
You're gonna drive.
Yeah, you're doing laps.
Yep.
You're hoping you may park at the little Mexican restaurant for $30 or something.
Go in, grab a margarita, get out of there.
Yeah. No, for real. Okay, so Pass a Grill is your spot. That's where you're reading your nonfiction. Mm-hmm. We know where you like to go eat. What is there anything else? What are we missing? What else do you like to do here?
In St. Pete?
Yeah.
I mean, there's really nothing that I don't like doing. But that's my day to day. I mean,
Right.
I go to work and I love my job. A lot of times I get to ride my bike to work now, which is cool because you can get the Pinellas Trail, runs like right behind the office.
Nice.
Yeah, and it's good just like get out in the morning and move a little bit.
But you're like abnormal than most. Like
I am.
Yeah.
I admit.
I'm going to go to Sweat at 6 a.m. and I'm going to go teach a cycling class on another day. I'm going to ride my bike to work. Mm-hmm. Yeah.
And then I'm going to take my dog for a run.
Because Bear needs some exercise too.
She does.
Yes. That's awesome. Well, hey, I really, really thank you for coming on.
Thank you.
Yes.
I'm so honored that you even thought of me.
Yeah, of course. Look, this is what it's all about. Just the community of St. Pete, local business owners, those are making cool impact in the city. And anyone who gets a chance to meet you, they'll be enlightened. And yes, of course. So Sunshine City Dentistry, how do they find? Do you guys have a website?
We do.
Yeah.
SunshineCityDentistry.com is the website.
Yes.
Also, the handle for Instagram. The Instagram page is very much lacking at the moment.
Yeah. Okay.
But I'm working on it.
Yeah. Well, kind of tough. I mean, content around teeth.
I know.
Yeah.
One of my friends told me to try TikTok.
Well, yeah, all the platforms. You gotta do it
I don't
all.
even.
What do I do with a TikTok?
How do we do? I'm too old for this.
How
what
do I
with
TikTok?
the TikTok?
Fair enough. And if they want to find you and come to the cycle bar class,
Alexa Moccia.
look her up, folks. Appreciate you. If they've been listening this far, what should we put in the comments? What word should we have? Floss.
I like it. Floss.
You like floss?
Let's go.
If you're still listening, put floss in the comments. Thank you for everyone. If you have made it this far, comment, like, subscribe, share with a friend. We're having a lot of fun here. Appreciate you. You and all your support is why we keep this show going. So thank you for that. And again, if you know anyone looking to buy, sell, or invest in real estate, find our contact information below. Love you all. Have a fantastic day. See you on the next one. Boom.
Boom.
I need a little more.
You need a little bit more.
For a little cheers.